Good evening, everyone. This is Tiffany Jackson, naturopathic doctor and nutrition specialist at Cenegenics Carolinas. I want to welcome you to tonight's webinar, Cenegenics Carolinas, What's in It for Me? The top 5 questions to understand before you become a patient. We're excited that you have an interest in joining an age management medical practice, and we understand you might be a little confused about what you've read on the internet or not understanding how Cenegenics Carolinas is different from other medical practices. So we're hoping tonight's webinar is going to clear up any confusion that you might have and explain why we are the global leader in age management medicine. Anytime throughout this webinar, we have our staff available here this evening to take your call, so feel free to pick up the phone and call us 843-724-7272. Tonight we have all of our Cenegenics doctors on the line, Dr. Mickey Barber, Dr. Chris Nagy, and Dr. Randi Popp. They're all on to tell you what is in it for you when you join our program and to go over some of the top questions we get from patients calling in. So they're going to be available at the end of the webinar to answer some of your questions. Before we get started, I do want to share a couple highlights about our doctors. Dr. Mickey Barber is the CEO, CMO of Cenegenics Carolinas. And this past November 2012, she was awarded the top honor in her field and presented with the Alan P. Mintz Award for Clinical Excellence in Age Management Medicine. Dr. Chris Nagy, he spent more than 16 years as a board-certified orthopedic surgeon and is our chief medical officer at the Charlotte office. He's helped many patients improve their health and significantly diminish the impact of the aging process and has a strong passion for health, wellness, and education. Dr. Randi Popp comes to Cenegenics Carolinas following an extensive history as a primary care physician, owning her own practice with a primary focus on hormone optimization, and she has an excellent patient care record and is all about prevention and optimal wellness. So we really are blessed to have such an awesome team of doctors here at Cenegenics Carolinas, and I want to welcome all of you on the call. Is everybody there?
We're here. We are. Thank you.
All right. Well, let's go ahead and get started with the first question. What is age management medicine, and how are we different from primary care physicians? Dr. Barber, since you're the CEO and been in age management medicine the longest, let's start with you.
Sure. I'm also the oldest, so I guess that's a good reason too. So age management medicine is really about helping us to look and feel younger with every passing year, and most importantly, to prevent disease. So that's a big difference. Primary care is really focused on disease, and insurance companies pay doctors to treat disease. So we're really about kind of being ahead of that. So most of our patients come in and they're healthy, and we're going to keep them that way. I think another big difference is that we give our patients attention. I think that's one of the things that people really miss when going to see their primary care physicians these days, is they don't have time to give them that kind of attention. And we're also more comprehensive. We provide a synergistic program that focuses on exercise, nutrition, lifestyle, and hormonal balance for our patients, and it's more comprehensive and then allows us to give a very individualized approach. So, Dr. Popp, most recently you were working as a family practice doctor, so I'd like to hear your comments.
Yes, I agree with everything you said, and again, leaving the primary care world where I was for 8 years and coming to this practice really points out to me the strength of the comprehensive attention that the patients get here. I was a solo family physician, and my patients thought that was great because when they walked in the door, they knew that they were going to see me and not a different doctor, but they still saw me for 10 or 12 minutes, and trying to get all of their medical and emotional issues addressed in 10 to 12 minutes was just virtually impossible. And it became sort of a cycle where we would see each other every month or two, and we would hope and pretend that things were getting better and labs were getting better and health was getting better, but really with that kind of time constraint, there's so very little that you can do that improvements were few and far between, and that becomes exhausting.
Yeah, that's a great explanation. I mean, here at Cenegenics Carolinas, we just have a completely different philosophy of staying healthcare and not into sick care. You know, we want to help people decrease their risk for disease. So thanks for explaining that. And for any of those that are just now joining us, we have staff here available this evening in the office to speak with you directly. So please call us at 843-724-7272. Next question is, how is Cenegenics blood testing different than the ones your doctor routinely orders? Dr. Nagy, I'll let you comment on this one first.
Well, I think the important word there is routinely orders, because in general medicine, there's kind of a routine set of labs you do that are kind of the bare minimum. And what we do at Cenegenics, we don't accept the bare minimum as being the meaningful test. We test for many other markers of disease, inflammation, and sickness. And we use some of the most recent and cutting-edge blood tests to help us define what may be happening before it even has a chance to occur. Many of these lab tests actually commercial insurance won't even cover because they don't agree. But really, we focus on obtaining the blood tests that most show the markers and show at the earliest time the risk factors for disease, for which we have treatment options beyond just drugs, but also nutrients, supplements, and other things, because we are not a drug-mediated practice. Cenegenics Carolinas tries to give the body what it needs to be healthy, and we use the lab tests that help indicate what is missing so that we can replace those and optimize your health.
And again, I think coming from the primary care world where I have been for so long, to me it was so frustrating to see patients walking in and either not able to get the blood test that they need because their insurance company won't cover it, or simply other doctors in the community don't check for certain levels. I'd have patients walk in all the time complaining of fatigue, weight gain, I can't get motivated to exercise, and yet when I look at the recent blood tests that they have done, it might include a TSH for thyroid activity, it might include a sugar, and usually those patients have been told, oh, your blood tests are normal, you just need to get some more exercise, and they're out the door in 8 minutes. So what we do here is we really break those markers down, and thyroid is not just a TSH. Thyroid disease depends on a T3 level, a T4 level. And again, you put those numbers all together in a panel combined with the patient's presentation, and you can come up with a great treatment plan for that patient and make a world of difference not only in how they feel, but in the status of their health.
Yeah, good point. And our routine blood test is very comprehensive. So that's a big difference because it's looking at disease risk markers, certain vitamin levels, free and total hormone levels, and certain inflammatory markers. So it gives us a bigger, broader picture. And now we have even more tests available to really look at patients' risk of heart disease and stroke and really kind of dig a layer deeper into not just the cholesterol panel, but the different particles and genetic risks and inflammatory markers that are really kind of newer age medicine that allows us to really kind of get ahead of the game and prevent heart disease and stroke. We also can test for food allergies, and we have a lot of other things that we can do. And so it allows us a comprehensive approach that can be done in a very private setting and really start to put together a comprehensive corrective action plan.
Great. So if any of our listeners out there are interested in learning more about some of our comprehensive lab testing that we do have available, we have staff here to answer your questions. So just call us 843-724-7272. All right, the next question. What are the side effects of hormone replacement therapy, and is there a risk of hormone replacement therapy causing cancer?
Well, I'll take that question, and that is an important question because that's a question that's frequently asked whenever you mention the word hormone replacement. And honestly, the bad results of hormone replacement are the results of bad hormone replacement. And what I mean by that is when you look at the controversial studies or the studies that define hormone replacement, most of those studies really didn't even use hormones. They used drugs or synthetic substances which mimicked the effect of hormones. At Cenegenics Carolinas, we use what are called bioidentical hormones. And those are hormones that are structurally or molecularly identical to the hormones in the human body. So the body recognizes these hormones as its own and knows what to do with them and how to break them down and metabolize them. And specifically, when we're talking about hormone replacement, often everybody thinks we're talking about women, but we're talking about men too. Just as women's hormone levels decrease, men's testosterone levels decrease significantly as a process of aging. And as the testosterone levels decrease, it opens a man up to all kinds of risk factors for disease, Alzheimer's, heart disease, decreased body mass. So it's important for a man to have an optimal testosterone level, not just for erectile dysfunction or for sexual matters, but for his overall health. And that sometimes is overlooked in the media. People just think testosterone is about sex, but it's about having a healthy body. And it's important that if you're going to consider testosterone replacement, that it be done by someone who knows what they're doing. And that's what we're the experts at Cenegenics Carolinas.
Yeah, good point, Chris. And you know, there are as many myths out there about testosterone therapy as there are about estrogen and breast cancer and the risks for women of heart disease. And a lot of that has to do with what you said. The studies that have been quoted so often were really studies looking at the wrong kinds of hormones or bad hormones. And then there was a lot of misrepresentation of the data. And then the media got hold of that data, and then next thing you know, they were scaring men and women all over the country, really. The good news is that recent evidence has been reported by the International Menopause Society that really overturns many of these previous findings. You want to make sure that you're working with doctors that know that and that are up on the latest literature, because that's really important, because, you know, things in medicine change, and there's been a lot of misrepresentation out there.
Great. All right, so for the next question, why do you need Cenegenics Carolinas if you are in good health?
I think I have to start with that question because it almost makes me laugh, because I think of my patients, again, in the primary care world that come in thinking they're in good health. And in South Carolina, being in good health can be defined as having not had a heart attack. If the patient hasn't already had a heart attack and a stroke, they feel like they're healthy and they're doing great. And the point is, let's not ever get to that point. Let's intervene in their 30s or their 40s and prevent that family history of heart disease from happening. The question becomes, do you want to be good, or do you want to be better, or do you want to be optimal? And that's the journey that you're going to take at Cenegenics Carolinas. We're not going to settle for normal. We're not going to settle for a normal testosterone level. We're not going to settle for a normal blood pressure. We're not going to settle for a normal energy level. We want you to be the best you can be, and it's a journey. And every good decision that you make puts you in closer and closer to that goal of being optimal. And I think that that's a different mindset, not only for the patients, but for the doctor. And that's what you're going to get when you come here. You're going to get a doctor that's focused on your best optimal health, not just falling in a normal range of whatever parameter you're looking at.
Right, right. And, you know, primary care and all the doctors that are out there who are doing a great job, you know, don't really have time to work on that preventative aspect. So even if you're in good health now, the question is, what are you doing to stay that way? And what are you doing to prevent things like heart attacks, stroke, cancers, dementia, Alzheimer's? And a lot of people think only people come to us who need to lose weight or who are having some challenges with energy or some other issues. Not true. We have a lot of patients who are doing a lot of the right things. Our elite health evaluation will document that, and congratulations for doing those things well, and let us help to take you to the next level. So, you know, don't think that this is just for someone who's out of shape or not exercising or on a ton of medications. You know, this is for the patient who's really working hard to do the right things. And finally, you have physicians and experts that you can partner with to take you to the next level.
That's great. So go ahead, call our office now. If you want to speak with someone directly, it's 843-724-7272. So one of the last questions here, why doesn't Cenegenics Carolinas accept insurance?
Well, if you look at the slide, you can see one of the reasons why we don't accept insurance. But in reality, the reason Cenegenics Carolinas doesn't accept insurance is because we want our entire focus to be on the patient's best interest, the patient's health. And oftentimes in accepting insurance, you're working for the insurance company. And oftentimes you're subject to the whims and the dictates of the insurance company in allowing you to do what you want to do. And oftentimes it turns into a battle. When you want to serve the patient's best interests, you know what you need to do, but oftentimes there's an argument or a requisition that needs to be filled out. By not accepting insurance, it allows us to put our primary focus on the patient and the patient's best interests. And basically that's the bottom line. There's much more details to that, but the primary goal is you, the patient, And we don't want to be distracted by that by having to hire a staff to argue with anybody else about what we believe is the best thing to do for you.
Right. Yeah, that's true. And you know, a couple other things. I mean, insurance companies pay for treatment of disease, which, you know, we're not doing. And the second thing is privacy. You know, our patients come here and they're treated in a very private, individual way. Once you have any kind of diagnosis, you know, in your medical record, then it is following you for life. So that's another really important part of our program, and allows us to really give that personalized private medical attention.
Great. I know, too, a lot of our patients just love the full access of speaking directly with the physician anytime with emails and phone calls, and you definitely don't get that with insurance. So I hear patients comment on that a lot. So that's about it. Those are our top 5 questions. Are there any last comments that you doctors would like to make before we take some questions?
I would just like to say thank you so much for everyone for tuning in this evening, and I hope it helped to answer questions. The 3 of us are going to be available at the end of this call, and we also have people in the office available to answer additional questions that we might not have covered.
Great. Well, this has just been wonderful. So thanks again, doctors, for being here, and thank you for all of our listeners tuning in. We would like to take some questions, so you can go ahead and type your questions on your computer, and we'll get them here and be able to respond. And while you're typing your questions, we did want to tell you something very important. I had a chance earlier before the webinar to speak with Dr. Barber, and she has decided to do something that she has never done before. And we are going to offer you, our listeners, a friends and family discount and give you $500 off our Elite Health Evaluation. That is, if you call right now, we can't extend this offer too long, she said. So if you're listening to this, if it's a recording, you can call to see if it's still available. But just let our staff know when you speak to them and mention that Dr. Barber offered you a friends and family discount on the webinar for your Elite Health Evaluation. So we are your answer for healthy living. I can't even begin to describe all the health benefits that our patients do experience here at Cenegenics. Increase in energy, revitalized sex, decreased body fat, mood, skin. I'm telling you, if you're looking for an age management medicine program, please give us a try. Okay, it does look like we have a couple questions coming in. So, Dr. Barber, are you there to take a question?
I am. Fire away.
Wonderful. Okay, here we go. What type of hormone therapy do we use? Do we do injectables, oral, or topical?
Good question, and the answer is depends. Typically for women, they tend to be primarily topical or oral, depending on which hormones we're talking about. Typically for men, it's a combination of injectable and oral. We don't use topical for men in general. There are some reasons testosterone doesn't work as well if it's applied topically for men.
All right, next question. A listener wants to know, can you explain the difference between synthetic and bioidentical?
I'll do my best. It's kind of confusing. Basically, the synthetic hormones, when I think of synthetic, I think of things like Premarin, for example. Premarin's been around forever and forever, and as most of you probably know, it is made from pregnant horse urine. And if you were to open the PDR, the physician's desk reference, and look at Premarin in that reference, you would not see the word estradiol, estriol, estrone, which are real estrogens. You would not see that listed as part of Premarin. Why? Because they have to take, in order to patent the hormones, they have to take the hormonal structure and then alter it some or synthesize it. So it no longer is exactly the hormone that it started as. So bioidentical hormones are the actual chemical structure of the hormone. So what does that mean? That means that they are going to fit on the receptor in the body exactly like a key and lock. And so they're more likely to get the benefit that you want and less likely to cause the side effects. Now, our hormones are quote-unquote bioidentical, meaning that they are made from plant sources. Typically that is soy or yam.
Obviously, we can't take a soybean or a yam and just rub it on our skin and get the hormone. So there is some synthesizing involved in extracting that compound, but it is still the exact chemical structure of those particular hormones.
Great. We have another question here that says, what is involved with getting checked out, and what is the closest office to Statesville, North Carolina? They also have some questions about cost, and I would go ahead and encourage that listener to call in. We have staff here right now. If you just pick up the phone and call 843-724-7272, we will be happy to answer all of those questions for you. Dr. Barber, do you want to comment anything about our Charlotte office?
Yeah, let me just comment that Cenegenics Carolinas, we have an office in Charleston and an office in Charlotte. So I would think that the office in Charlotte would be the closest. And the first step after talking to someone on the phone and getting your information, making sure this is a good fit for you, would be to have an elite health evaluation done at, sounds like the Charlotte facility, which is about a 6.5 to 7 hour day. And whoever is manning the phone back at our office can answer all the questions for you about what that entails and the cost involved.
Okay, we have another question. What can our program do for cognitive function and memory?
Yeah, great question, great question. I mean, the first real important question there is, what do we do to evaluate whether it's an issue or not? I mean, one of the things that's really kind of shocking to me with Alzheimer's disease and dementia being like a leading cause of disability for the aging population, I mean anyone over the age of 50 really, the general practice of medicine does not even evaluate memory as a basic vital sign. So we do a cognitive and memory evaluation as part of our elite health evaluation. Very, very informative, gives us a lot of information. If we find that there are some deficits, and we do, typically we find there aren't more often, so that's the good news. But if we find that there are, we have several options. One, balancing the hormones is extremely important. One of the things that we know for sure is that testosterone in men and estrogen in women affect cognition as those levels start to decline, so extremely important. Second is sleep. We really focus very, very much on helping our patients get a better night's sleep. 3 is nutrition. Lots of things we eat or don't eat can affect our memory and cognition. There are even some exercises or games that can be done once we isolate exactly what the issue is. There are some supplements that sometimes we recommend, so there are lots of things that can focus on improvement in cognition and memory.
Great. Well, I think that is a great way to wrap it up there, Dr. Barber, and thank you to Dr. Nagy and Dr. Popp. I appreciate your time this evening, and thank you listeners out there. Again, feel free to call our office. We're still here. We'll be hanging out here probably for the next hour, 843-724-7272. We look forward to speaking with you and hopefully seeing you in one of our offices here as a patient in the future. Everybody have a good night.
Thank you.